Hello, everyone, and thank you for tuning in again to Small Town Johnstown. I am Jenny, and I have a guest with me today. So if you want to go ahead and introduce yourself to our listeners and viewers.
Yeah, thank you so much for having me. I'm excited to be here. My name is Kaitlyn Schultz, and I am a owner and chiropractor in the local area. So I wanted to come on here and just talk about what I do and just have a good conversation about it.
Yeah, so we have spoke to a lot of business owners. So I guess just off the top, like how'd you start your business? How'd you open it? Like, what was that process like?
Oh my gosh. Yeah, I feel like I was thrown into the deep end of the pool.
Yeah.
I kind of didn't really have a choice. I originally had wanted to maybe at most 2 more years to open, and just circumstances happened as they did, and I was unemployed. So it was either I find another job in a completely different field, or I opened my own business.
Yeah.
So that was in the spring of last year, and I ended opening up my practice that I have now, Halloween. So I just celebrated my first year. I was like, of course I would do that on Halloween. But it was the best thing I could have imagined, and Guiding Point Health Center came to be, and it's been a really great ride this past year.
Really?
For sure. Yes. Yeah.
Have you met lots of new people, or did you pick up, some of the same clients or patients from the last job that you were at?
I was incredibly fortunate to have a lot of very loyal patients follow me through my early part of my career.
Yeah.
And definitely quite a few of them stuck with me into the new practice, which I am so grateful and thankful that they have that much trust in me. I talked about trust when I had a little gathering last week to celebrate the 1 year. So it's honestly, it's all to them. Like, all the credit is due to them in terms of just trusting in me and referring people to me. So I've been extremely lucky.
Yeah.
Way.
It does take a lot of trust too. I know a lot of people are kind of on the fence, especially on social media, about chiropractors, because you're dealing with some very serious parts of the body, and you screw up once, and it's very easy, or people are very fearful that like they're gonna get messed up, break a neck, whatever it is. So how do you deal with that? How do you get people to trust you like that?
It is time, and I often like to use humor to kind of dispel nerves, and I also really love the power of knowledge. So I know sometimes it can be a lot of information that person may receive their first day that they come in and have their initial consult with me, but I really like to lay out all of the possibilities. And I always joke, I'm not going to Steven Seagal your neck. And I actually said that to a patient recently, and he's 25.
Yeah.
And he was like, I'm sorry, but I don't know who that is. So I have to come up with different things to relate it.
Yeah.
But I am always open to other ways of adjusting as well. I came from a mostly instrument adjusting source of working. So using my hands is always a thing that I do, but I was very lucky to learn early on a lot about activator method, use the impulse, so people also have that option, and a lot of my patients come to me because I use instruments, so to them it's much less intimidating. I'm not taking your head or your neck and like twisting it, and I tend to, in my manual adjustment, so that's when I just purely use my hands.
Yeah.
I tend to try to use relaxation techniques anyway, where I'm like, sometimes we have to distract you. So wiggle your toes, take a deep breath. And I would say I'm probably not known for being a really rough adjuster, which some people love, some people don't. The people that come to me love it, right? So I think you gotta, as a practitioner, there's always, and in life in general, you have to know who you can maybe be a little more forceful with, and who you might need to like take a couple steps back and just ease them into it.
Yeah.
But I find humor is the best way to get people to kind of...
Yeah, because you need people to relax to be able to do anything.
If they don't relax, I often tell them that. If you're finding that you're really sore after an adjustment, and maybe that practitioner isn't even using a lot of force, whether it's massage, chiropractic, any type of like body work, chances are you may also be very tense. So I also love using somatic exercises like breathing. I do a lot of that kind of stuff in my practice anyway, kind of bringing in the body to help us, the breath to help us just let it go and release that tension that you might have because you're a little nervous. yes.
Yeah. And I'm sure a lot of people are, especially first-time people who, like I said, are very skeptical about chiropractors. And
those are my favorites, though.
Yes.
Because then when they change their mind,
they're like, oh, this isn't so bad. Yeah.
And then they feel better, which is even better, because then you see the light in their face that they're like, I'm not literally like so miserable walking around all day because of my back or my neck or whatever.
Whatever it is,
have you. Yes.
So you said you do like manual adjustments, like just your hands, and then you also do instruments, like less, but you still offer those services as well?
Yeah, I would say, honestly, I do mostly instrument, to be honest.
Really?
Because most of the patients that come to me are from the days where I was only doing that, because I've been in
So you've just kind of evolved.
Yes. Okay. Yes. So I would say it's more the other way around, where I do mostly instrument adjusting and then some manual if I feel that someone really needs it.
Okay.
I always ask permission, hey, would you be open to this if they haven't been adjusted that way before, if they've maybe said, I don't like that. There's a lot of people that come to me and they're like, it was too much, I got hurt, or like it just didn't feel good, or whatever their story was, which I will put that disclaimer out for chiropractic. If a practitioner who is really trying to take the ethics and the welfare of the patient, which should be every practitioner, being injured through chiropractic is such a low instance. Yeah. That's why our malpractice is extremely low. There is scientific basis behind the actual practice to back it up as to how we're influencing the nervous system. But most people's trepidation, like I said, comes from, I tensed up that last minute and I ended up sore. That's honestly, those are most.
If that's the worst thing that can happen.
Yes. Yeah. And that's often when I tell patients, I may make you sore, but let me know. There has to be that clear, because I think a lot of people just don't say anything because they feel like they can't.
You have to speak up for yourself in any medical field. Like if something is painful or doesn't feel right, like then it's probably not being done the right way, and you need to speak up for yourself.
Yeah. And it could even just be, let's face it, not everyone is comfortable, even though they're coming to a chiropractor, a massage therapist, or whatever have you, PT, right? Physical therapy, they're using their hands on you as well. They may not even realize that they're actually not very comfortable with touch to begin with.
Yeah.
Or they may have had something in their past that influenced that way. So trying to take all of that in consideration when you're taking a patient history, when you're really feeling out where that patient is mentally with their pain and where they are with their relationship with their body, is extremely important. And also just reading the room, reading the body language. Yeah. Like if that person's grimacing, maybe their body just doesn't want to go that way.
Yeah.
That's what I love about the instrument, because you can basically get in there and, for lack of a better way of saying it, you basically get your hand still on the patient, and it's often you're not having to bend them into a certain way, especially
like twist them a certain way. Some people don't like being squeezed or massaged. Like some people just aren't comfortable with that. It's funny because my mom's actually a chiropractor.
Oh, she is? Yeah. That's amazing.
And I just went to her the other day because I've been having like all kinds of back issues. I just found out I have scoliosis this year.
Oh my gosh.
Yeah, I know. And I'm 25 years old. So very late diagnosis for that. And, she always offers to do myself and Nick. And afterwards he was like, it's not that I don't like it. I just don't think I like being touched very much. And I was like, That's fair. That makes sense. Yeah, like that's fine.
Yeah. Yeah. But you got to find, like you said, you have to advocate. And I always tell patients, please speak up. I can't do anything if you don't tell me anything.
Yeah.
Like if something's not working and we're into your treatment plan and you've not yet to say anything after 3-4 weeks, there's really not much I can do until you do say something.
Yeah.
Right? Because I think there's just this general belief that all doctors know everything and they should know everything and they should be able to anticipate my every want need. And that is just purely not true. Like that's impossible to be able to do that with every patient.
Yeah.
So I always tell my patients, advocate.
Yeah, advocacy and communication is very important in healthcare.
Yeah.
Because, you might not specialize in every single thing, but, I try to bring to my doctor everything that I know could possibly be wrong with me. So if some pieces are, put together of, what could be wrong, like I went in with the back pain and she, advocated for me to go get x-rays and everything. So if I wouldn't have mentioned that, I still would not know, what's going on with me.
Yeah, exactly. And I always say too, even if I'm not the person that's completely fixing your issue, maybe I'm that practitioner who, like you just said, maybe we should get an x-ray of this. Maybe we should move on to an MRI. Maybe we should move on to some PT or do both. Like, there's so many different avenues we can go down. And I always try to be cognizant to know that I may not be healing, quote unquote, everyone that comes through my door with chiropractic, but I may be the next step that they needed to take.
And my mom's done that a lot too. Like, if she thinks something is wrong, like, she will refer out, she'll send people where they need to be. You
have to be humble enough to know that, like, a
referral, this is not for me. We need to scoot it somewhere else.
Yes, and I think that's a really powerful thing that all medical practitioners should know, that you do have the power, even if you're not the one solving the issue per se. You are part of the solution in terms of the power that you have, because, again, patients inherently, it's strange where we just kind of talk, they might not trust in terms of touch, stuff like that, but there is still this, like, inherent trust that patients are coming in to see you, and somehow on some level they know that hopefully you're going to do right by them. And that's a very, very powerful thing to have as a medical health, however you want to phrase it, practitioner. And I think I would love to see, especially in this community in Johnstown, that more of us collaborate, because sadly I've been on the other side of other practitioners maybe saying things that they shouldn't, not in the best interest of the patient, not having certain beliefs about chiropractic or any other health modality when they don't even really know the full story. And now you're kind of blocking that person's ability to make an informed decision. So I also always want to give patients all the information that they could possibly have so that they can make the decision, not me.
And that's the most important thing, is to communicate, this is what I think is going on. You don't know someone else's body as much as they might, but you might have some suggestions that they hadn't thought of yet. To get, whatever it is, checked out. Hey, maybe you should get an X-ray, MRI, or whatever it is. And you have to be honest about what you think is going on. If someone comes in with back pain and you think that something really severe is going on, you have to say, look, I can't do this. I don't want to make you worse. You need to go.
There's been patients I did that with. I don't do it often, but I know people have asked me, well, have you ever referred someone to surgery? Because that's all, somehow there's like this battle, I guess, between chiropractors and surgeons or whatever the case may be. And I was like, actually, I've referred 2 people and they both really, really needed it. You know what I mean?
And like you said, you need to be humble enough to say, I can't, I would suggest.
I am not adjusting this away, sir. You know what I mean? Like, you need to get thee to a surgeon, and here's 2 really good ones that I trust. And that I know will do a full workup. They're not just going to cut you open to cut you open. And I feel like the people that really do need a back surgery or whatever type of surgery do very, very, very well after they have it. It's the people where they somehow got lost in the system and they end up having like 2 or 3 back surgeries. We call it failed back surgery syndrome. So those are the people that maybe that wasn't the thing that they needed, but now they're kind of stuck because now they're having all this other stuff going on. But it's not all doom and gloom though. I see some pretty cool stuff in practice.
I mean, surgery is hard, and that can go a number of ways. And like you said, you have to recommend the surgeons that you trust. There are surgeons out making people worse, taking out the wrong organs and
it's
things like that.
Yes, it's everywhere. And that's like sometimes what's frustrating about when you get someone who's like, well, this chiropractor did this and they like weren't helping me. And I think taking a step back and hearing, that's like also another huge thing that I try to really work on in practice, is just being curious. So not taking it personally. Taking a step back when that person's kind of airing their grievances, really getting to the root of like, well, okay, well, where is this coming from? And then for me, I always ask a patient if I feel that they need to hear a hard truth, and hopefully they receive it in love, right?
Some people don't.
They don't, and that's okay. That's where they're at. But it's often not what you say, it's how you say it. I learned that from my first job. And so I'll kind of, again, bring humor into it. And I'm like, hey, Mr. or Mrs. So-and-so, are you open to me being like brutally honest? Yes. But nice. And they usually, they'll laugh. And they'll be like, and I'll be like, this, and this. Did you do your exercises at that other place? What's your diet like? How's your sleep? have you been really stressed about your son, your daughter, your family, your job? And it kind of, you see like that light bulb kind of click, like, and like they're like, oh my gosh, I guess I do have to take some personal responsibility for this. And the fact that maybe I didn't give this practitioner a chance, or the fact that I didn't really have time at that point in my life to undergo the treatment plan, or like whatever the situation was.
Yeah.
Like it's generally never just one thing. There's a whole host of things that like wrap up into maybe why PT didn't work, or chiropractic or massage or whatever.
Because there's a lot to it, because, you know, you expect the doctor to fix you and help with your problems. But if they say you need to do PT, you need to eat better, you need to exercise, and you don't do that stuff, you can't stay mad at the doctor when they gave you the homework of, okay, you need to take care of yourself in this way for me to be able to continue helping you.
Yes, because I think there's this illusion in our healthcare system that like just by going to a doctor and popping a pill or trying exercise once, all of a sudden now you're going to be 100% better. And that's just such an illusion that we sell people, whereas I'm a total believer of you are your own best healer. Like your body knows what it needs. You just might need guidance to know where to go to get it.
Yeah.
And you need guidance to know what modalities work for you. But once you have that information, knowledge is power. So it's super important that people also follow through. So I really hold people accountable in my practice. Some people love it, some people hate it, but for better or worse, usually I always say, usually the people that listen and try, they might not do it perfectly. I'm not asking for perfection. I'm asking for you to at least try it and see how you feel. And I can honestly pat myself on the back and say, most people that try it come back maybe in a month as we're going through treatment or however long they're with me, and they'll be like, you know what, I'm feeling different. I'm feeling better now. And then now they fall into the rabbit hole of like, well, what else can I do to like make my life better? And I love having that positive outcome, because it takes all things, like, you know, that saying, it takes a village, but it really does take a village in terms of our health. And our healthcare system definitely needs some revamping in terms of how we approach that.
Yeah.
100%.
You have to take patients seriously, but like I said, like patients also just have to
take it seriously.
Listen and take it seriously. So like, what about the patients that don't take your advice? Do you have any of those, and do they even come back to you? Like,
yeah, I think that's like the bane of all of our existences as like, even if you're like a teacher, like whatever your situation is when you deal with people, right? And yes, I absolutely have had patients that don't want to hear it. But guess what? Some of those patients have actually come back. And then the next time around, they do listen. And then I've had patients that just thought that they should be better from a condition that they've been struggling with for like 3 to 6 months. They thought that they should be better in 6 to 8 visits. And I'm kind of trying my best to find my happy medium as to how I want to run a treatment plan, how I want to communicate that to a patient. And so I've definitely had a couple that just didn't come back, and that kind of has to be what it is. But I always tell them, and I learned this from my first job, I always tell them the door's open. If you ever want to come back, don't think that you can't, or that I'm mad or upset. It's more of, I just want you to be better, and I wish it could have happened here. Is more my thing, because I'm like a high achiever type person. So I'm like,
I understand that.
Perfect. But I know that that's not always possible. But guess what? If they go somewhere else and it does happen, I'm cool with that too.
Yeah,
that
just
means
so they're better.
Yeah.
And I feel like some people are very skeptical about doctors and don't necessarily think that. They think they're in it for the money and different things like that. So it's kind enough that you allow people to, you know, seek help and treatment elsewhere if they feel it is necessary.
And I also understand too that I run my office a little bit differently in that I am not a participator in insurance.
Really?
So that's
tough for people. Just everything about health insurance is just,
I know that was like a wild move for me to make, but I was like, if I'm gonna do this, I'm doing this my way.
And that's fair. It's your business.
Yeah. I'm not being beholden to these, for lack of a better word, corporations, because that's what insurance companies are. Them telling me how I should treat, how long I should treat, because most of the time they're shortening patients' treatment plans anyway. And then patients get upset because they're not covering it. And yeah, you're paying what, $300 to $400 for a premium a month, and that's on the cheaper side.
Yeah.
Like if you have a family, your premium's much more expensive.
It's insane.
Even if you're getting it through your work, it's still expensive. So I understand that. There's always that thing where, and again, I learned this a long time ago, most times why people aren't consistent with your treatment plan or consistent with the things you're suggesting and they leave is because of time or money. Mm-hmm. So I also try to be very transparent about what all my prices are on my website. And I communicate what I think the amount of time. And I always say to patients, know that if you can't come, I try to kind of keep it to maybe twice a week. There's very rare that I'm recommending 3 times, but it just depends.
Yeah.
But I always tell them, if you can't come as much as I'm suggesting, just know to go slower. And if you're okay with that, cool. And if you start getting frustrated, I'm going to remind you in a very loving way. Yeah. Like, remember what I said. And if that's also an obstacle to you being able to see me, here are some people that maybe you'll still do just as well with, but it'll be more workable. So that's also a tough pill I've had to kind of swallow. Mm-hmm. And I went back and forth, especially this past summer. Should I get back into insurance? What's the right thing to do? And I couldn't, because it's a huge amount of stress and work on a doctor's side, especially as a one-person practice. Mm-hmm. It hinders, I think, patients' sovereignty to choose and to make their own decisions, because you ultimately have this insurance company telling you what you can do and what's covered. So they often don't want stuff if it's not covered anyway, even if it will help them. Yeah. And quite frankly, I just have heard nothing but bad from many other practitioners. Yeah. And the more I see, the more I'm like, I'm just really glad that I do not have that stress in my life anymore. Because it's a soul suck.
Have you lost any patients because you're not doing insurance?
Yes. I definitely have, especially, and this is like this has no, of my opinion about this type of insurance or the type of client. That's not what I'm saying. I would say a lot of the patients that were probably more Medicare, Medicaid, or like the UPMC for you, that kind of stuff, I understand. Yeah. Like, you're on that because there is a bit of a constraint with what you're
financial
able to
barrier.
Afford. Yes, there's a financial barrier, which is hard. And I had to just gracefully let that go. That hurt, because there were a lot of patients that I really love seeing that were on that type of insurance. And this, I may sound whatever type of way when I say this, but for me, what I do is worth more than the $11 or the $12 that the insurance company is giving me to adjust you. No, it's more of a self-respect thing. Yeah. And I wish that it was different, but I also feel like it's like this vicious cycle of, okay, we're pricing it this way so people become accustomed to that, but that's not even really what we're worth. And now we're just like stuck in the cycle of like accepting less. Yeah. And then also communicating to patients that we're worth less. That's what we're worth. Mm-hmm. When really we put a lot of time into our education. I put a lot of time just outside in the last 8 years that I've been in practice. A lot of time and money into my continuing education to be the best I can be. So I feel that there's just a certain level that I'm willing to accept now. Mm-hmm. And
you know your worth.
Yeah, you got to know your worth. And it's like, it's touchy because it is healthcare. I feel like there's this stigma of, if you're a healer, whatever you want to call it, that you should be, that you shouldn't expect that you should work for next to nothing, because that's like your calling. You know what I mean?
It's hard, because at the end of the day, we live under capitalism. So you do have to set some sort of rates
that too,
for you to survive. And like I said, get your worth with all the school that you went through, because it is a lot of school. Yes. To even be a chiropractor, and you're worth more than $11 for sure.
Yeah, it's hard because I some way I think I'm gonna figure it out. I have a couple ideas as to where maybe I can meet those people and still kind of not really buy into the insurance machine. Mm-hmm. So I have a couple ideas that I'm not gonna like talk about too much here, but because I want to see them come to fruition. I want to know if it's even possible.
Yeah.
But I do want to, I want to meet people where they're at, because I also know the area that we live in.
Yeah.
It's a blue collar area. Lots of hardworking people here. I'm from the area. I grew up in Westmont. Both my parents worked my whole life, my whole childhood. So, and with the economy the way it is now, I know it's hard, and I don't want finances. So I'm trying to brew up some ideas, especially now that I'm in year 2, and I feel like I can have a little more freedom to kind of get creative, and I'm not so much worried about some other things that you are, when you're in that first year and you're like, oh my gosh, is this even gonna work?
You just need to see if it's gonna work, because they say like a third of businesses fail.
Yeah.
So definitely trying to tread the line and just survive for the first year and then start getting creative.
We're in our Thrive era now.
Good.
I'm so thankful. It's been an amazing first year. But like I said, I kind of want to talk about some other things that I offer too.
Yeah, I was getting to that. I wanted to ask, like, what else do you do outside of chiropractic? Because I saw you do Reiki as well.
Yes.
So yeah, talk about that, and go ahead. I'll let you have it again.
Thanks. Nothing better than on a podcast where you could just talk about all the things.
Yeah.
Especially about yourself. But no, I love Reiki. Reiki is energy work, for those who don't know. It operates off the principle, if you've ever heard of co-regulation with the nervous system. So just with us sitting here side by side, I'm not upset, I'm not yelling, I'm not crying. That makes you feel calm, right?
Yeah.
So we can both sit here and vibe, essentially. That's what co-regulation, when we all can kind of manage our nervous systems and be in a state of just rest and calm. Because guess what? The person next to us is also in a state of rest and calm. So for me, as that energy worker or that practitioner, I'm essentially using that with my patients, and I love it. They come in, I have a separate table that's a massage table. Usually I have patients just lay down on their back, and you can either make contact with body or you can hover right over the body, just because depending on your belief system, energy can go through any material, essentially.
Yeah.
It's just like radio waves. We can't see them, but we know that they're traveling, right? They're traveling through the atmosphere, through the building, anything like that. I use a lot of somatic practices, such as utilizing the breath. The breath is like the most powerful thing that any of us can use. If you ever check out my social media, so Guiding Point Health on Instagram or TikTok, I also post the videos to my Facebook as well, which is the same Guiding Point Health. But I do what's called emotional freedom technique, which love. Some people like it, some people don't, but it operates off the principle of acupressure and then affirmations. So if anyone's a huge affirmation person out there, I'm your gal, because I love affirmations. I say them to myself daily. It has changed my life within the last 5 years to help me be more positive, to help me create the life that I want to make, and to just help me keep moving in terms of this business and my life. But it utilizes both of those things. So there's certain points along your body, whether it's along like the side of your hand. We can then go tapping into like points on our face. So like our eyebrow, next to the temple, under the eye, under your nose, under your chin, right at where your collarbone is, into your armpit, and then on the top of your head. And so you kind of tap, I'm showing her like this, and you can tap as slow or as fast. And basically utilize affirmations about certain things. Say you're struggling with anxiety. So we usually start off saying, even though I struggle with XYZ, so maybe it's anxiety. Even though I struggle with anxiety, I love and accept myself exactly as I am. So we're naming the thing that we're struggling with or that we're afraid of, which is powerful in and of itself. I also can use it for chronic pain. Even though I'm struggling with this chronic low back pain, I still love myself, because I think people can get really upset at themselves when they feel like their body's kind of like betraying them. You know what I mean? They didn't even realize they were angry at their body. And then through the different points, you can say, I'm open to understanding what this pain is about, or I'm open to what the anxiety is trying to tell me, because maybe you're on the edge of burnout and you're really pushing yourself. is it strange that you have anxiety if you've been working yourself to the bone? Probably not, right? That's your body's natural reaction.
Yeah.
We just live in a society, you've already hit on it, where like stopping means death in this society,
Yes.
right? There's no time for stopping, only stress, you know? And so with the tapping, you can kind of tap in even to those emotions that you weren't even aware of. So I love utilizing that. I use sound therapy, so sound bowls. I want to see if that evolves from the sound bowls, but right now I'm pretty cool with just like using the sound bowls, using the breath during our Reiki sessions. And yeah, that's kind of how I combine some of my strengths into that. I also I have an option to pair both the chiropractic and a 30-minute Reiki session, which I don't know why I'm surprised, but I'm very surprised that a lot of people have jumped on that, which is amazing because we get the body primed in alignment, right? We release some things that way, and then we get them on the other table and we release some things emotionally.
I like that, though.
Yeah.
I like that that's an option because I know a lot of people would, like to try Reiki and maybe they are in severe pain. Like you said, physical and mental pain kind of go hand in hand. So to me, it makes sense. But yeah, I feel like a lot of people wouldn't necessarily have heard of Reiki. I know that's a newer thing. We've had Rachel and Bree both on here, and they also practice that as well. I know Bree is more of the mental, like she studied like psychology.
Yeah,
she was a psych nurse and everything, so she's kind of more on that side versus you, who does the physical, chiropractic, spine, neck, all of that stuff.
None of it's separate though.
It all goes together.
Yeah, like I feel that I kind of, even though I did not study like as my major or as like my degree in psychology, I feel like I've really started veering that way in practice, where like I'm okay with asking those hard questions of patients, because time and time again, patients often will say when they're laying on the table, I'm so lucky they feel comfortable enough. I'm really stressed. You know what I mean? Or I've been really like battling this in my life. And that makes so much sense to me. Of course, you're going to hold all of those emotions in parts of your body. There's just no way that it can't. And I'm just lucky enough that I can deliver whatever that is physically. So that I think some people, you have to get it physically before they can handle it emotionally.
Yeah.
And that's the way my healing journey has gone, where oftentimes working with the body for me has really been helpful instead of just going purely from the mind. And that's a really powerful thing to be able to get into your body, because there's just so many of us out there who do not feel safe in our bodies for whatever reason. So I feel really blessed, honestly, that people, again, the trust. The trust has been there where they know that it's okay, it's safe here. You can cry, you can get angry, you can like do whatever you need to do. Move it, get it out of there. It doesn't need to be there anymore.
Do people come in that vulnerable often?
Lately, yes. I've had a couple people start crying immediately when they got in the office. They're like, I'm so sorry, I don't know why I'm doing this. And I was like, I know why, because you needed to be here. And this was like, maybe I was your last resort. And I love being the last resort, because that's when people, in a weird way, that's when people are willing to go there. They're willing to just like dive deep. But yeah, I mean, it happens on a weekly basis, if not a daily basis.
Really?
Yeah.
That's great. That's why you are a doctor and I am here.
You're doing this cool stuff in the media. Yeah. We all have our strengths.
Yes.
I've always been that way in practice though, because I don't know, it's my strength, I guess. It's a strength that I have. I remember I used to feel like it was kind of a curse, because
it can be, because then you want to help people all the time and then you don't have time for yourself. I see that all the time.
It can be overwhelming when you're not taking care of yourself, like myself as a practitioner. If I'm not, guess what? I am not immune. I have to do all the things just like everybody else to make sure that I can show up Monday through Friday for whatever's going to happen, whatever someone's bringing to me on that table. And I have to also shield myself from like trying to, because I know I have that bad habit of taking it on, and it's something I've had to work on, where it's not my job. All my job is to just with Reiki, you're not using your own personal energy to do whatever it is that the person needs. You are just a channel. You are a conduit of whatever healing energy, however you believe it is, however you want to call it, the energy that keeps us alive. It's something. It's the reason we are sitting here right now breathing and talking. I don't know exactly what it is, but I'm just supposed to be the channel. I'm not supposed to force it. And that's been like a huge thing in my life, to learn to just let it flow, because that does not come easy to me.
Yeah.
I'm not that
hard.
person. Yeah. I wish I was. I'm becoming more of that person. I can be that person one day.
So how do you take care of yourself outside of work, outside of, healing all these other people?
I get adjusted just like everyone else. That's what works for me. I go about monthly to get my adjustment. I haven't been doing it as much, which I do need to get back to. I generally go for like a short 30-minute massage about every month as well. Just to keep my physical body good to go. But in terms emotionally, spiritually, man, I'm out in nature a lot. I go frequently for walks outside. That's where I do some of my best thinking, or I just try to have no thoughts. You know what I mean? And just like enjoy nature and being present. So being out in nature, reading. Sometimes though I love turning my mind off and just watching trash TV on Netflix,
Same.
Being with friends, like, I have a habit sometimes of being a hermit. So I've really been working on connecting with other humans.
Yeah, you gotta force yourself out of the house sometimes.
Yes, yeah. Sadly, 2020 kind of reinforced the hermit being
everyone's
that I can
social
be.
skills, mental health, everything just plummeted.
Yes, that was like a hard thing to come back from, but I think it reinforced to me how important it is for all of us to do the things, whatever that looks like. Like, we have to. And we have to have community. We have to see each other face to face, not just texting or on Facebook or whatever. Honestly, I've really been, even though I have a presence on social media, I've really taken it on myself to limit how much I'm on it, because it used to just be you death scroll. Like, I would.
Yeah.
You go down the rabbit hole of whatever thing's on.
I still do. It's hard.
Yeah. On TikTok, you're like, oh my gosh, funny videos.
Yeah.
But it's like, I would post things and then I would just like look at everything else. Anymore, I'm like, all right, I'm going to post this and I'm off.
Yeah.
Like, I'm not going to stay on here because I know I have a life out there that I also have to be in. And those are like the biggest things, and just connecting with family, friends. And then I think I hadn't done it. I realized I hadn't done it in a long time, pursuing any other hobbies. So recently got back into some music. I sing with the Johnstown Symphony Chorus, and then just like, I'm not like a professional artist, but like art for myself, whether it's good or it's bad or whatever it is, just creating something. Yeah. I really enjoy that. I think people just need to find what they enjoy without it having to be genius.
Yeah, it's hard. I struggle with that because I love art and painting and things like that. But it's like, well, I'm not making a profit off of this, so why bother?
Why not spending the time on this?
Yeah, it's hard.
To make art just for the sake of art, that's what the people, right? When we didn't have any of this stuff, we didn't have podcasts, we didn't have screens, that's what they did. I'm just making art to make art.
Yeah.
And, like, I feel like even if it isn't a Van Gogh, or, like, who's to say that is, like, art can be, it's very subjective. Art is just art. So whether it's music, you doing your media stuff, writing, like, any of that kind of stuff, I encourage everyone to at least make some time for it, because it feeds your soul. And it helps you release some of the stresses and the tensions that we have in our day-to-day life. Yeah.
Absolutely.
Yeah,
So I think the last question to kind of wrap this up that I want to get into is, why do you think the people of Johnstown come to you? Like, what is it about this area do you think people need healing the most? And do you see any, like, common themes between people that struggle with something, whether it's back pain, mental instability, whatever it is? And do you think any of that has to do with the maybe poor economic climate of the area?
Wow, that's a good question. There are definitely themes that you see no matter where you go when it comes to maybe having a little bit more of a depressed, I guess, area in terms of economy. Like we said, I think access is a big thing for people. The general attitude towards healthcare or to health in general, I think has changed. It's starting to change, at least since I've started practicing. I'm seeing this wave of people that really want to take ownership. I think we got to give ownership back to people, that your health is yours. It's exactly that. It's only yours. No one is coming to save you in terms of that. You have to be your own advocate, and it can be fun. It doesn't have to be like this do or die thing, especially the earlier you start. So then you can prevent all of these things as you get older. But I think the people around here come to me because of the relationships I think that I form with my patients. We have a lot of fun. Yeah. It isn't all crying. It isn't all emotional. But they know that it could be if the day was off. Yeah. They know that they could sit down and be like, today sucked. Yeah. And I'd be like, yeah, buddy, tell me about it. You know what I mean? And then we'd get to work. You know what I mean? But like, we have a lot of fun. We just, I don't know. You have to enjoy it. You have to enjoy, at least at some point when you're in the line of work like this, where there's joy in it. There's lightness. There's just like we said, the trust, the faith that you're gonna, even if it does mean that they are gonna move on to another practitioner, the faith that they have in you, that you're gonna do the right thing by them. Because I'm just the type of person I couldn't sleep at night if I didn't. Yeah. And I think too, like you said with this area, I just have more faith though that people will come around to a different way of thinking, because I am seeing it. Yeah. And I think, again, knowledge, educating, in the last couple years when I was working for someone else, sometimes I would hear, you really got to dumb it down for the patient to understand. Well, yeah, if you use really big, long words that they've never heard, it's
scientific terminology.
It's not because they're dumb. They just didn't go to medical school. Yeah. Like, not everyone needs to go to medical school. That's okay if you didn't, or like chiropractic school, whatever. But I do think people are extremely intelligent when you give them the tools. And I want to approach every patient that they do have the ability to go and understand their health. Even if they can't explain all the processes of magnesium in the body, they don't need to do that. That's ridiculous. Yeah. I don't even really need to do that, because no one wants to sit here and listen to me talk about that. Like, if I came on this podcast and was like, well, listen to this, you would have been like, we're going to cut it. Like, you know what I mean? But like, if you give people the info and you foster them like a small plant that they just need the nutrients to go out and figure it out themselves, they will. And then you also have to understand that not everyone wants to go and learn about that, but they're willing to like take what you say and try it. Yeah. I love patients like that they're just gonna try it. I told this one guy, he was really like stressed out from the day's work. I wasn't gonna go into a whole spiel about tapping because he was probably gonna look at me like I had 7 heads. But I was like, you need to breathe. And that man, for the rest of that day, when he was in that office, he breathed. He used his breath to calm himself down. And I bet no one had ever sat down and talked to him like that. Yeah. He just needed a little bit of encouragement to try something new.
Just a little push.
Right?
That's all it takes sometimes.
Yes. So when you believe in people and when you know that they can, once they have that information, that's huge. And so I do that a lot. I have events in my office where we'll do like a sound bath and we'll do some meditation. Maybe some of these people never ever meditated in their life. But I always like to bring a practical application and saying that it doesn't even have to look like you're sitting on the floor to do it. You could be out for a walk in nature. That can be your meditation. It's just time or prayer or whatever it is you believe in. And I think people love that. And I think people also love that I'm like, don't do it just because I say so or just because I do it. Do it because you actually connect to the practice of whatever it is you're doing. So when people are aligned with that way of thinking, and because I know what I'm about, I also know that's why I'm attracting certain people, or I'm attracting more people than I did before when I wasn't in business for myself, which is okay. Yeah. But I'm attracting people that are aligned with what I believe or how I kind of move through the world, even though they may do it a little differently. And that also makes a huge difference when you know what you're about. It reads. When you cannot, my first boss said this, you cannot lie to a patient. They will always know. They know when you're distracted. They know probably when you're upset. They just don't know that you're actually upset. Yeah. Or they know when you're not fully with them. So when you're just honest with yourself and you're honest about what you're about, it just reads in the room. It does, and it just attracts your tribe. Like, it's the coolest thing, because I'm seeing it in my life. It's really neat. Yeah,
it's important to trust your doctor, and like you said, honesty. If my doctor lied to me about anything, who knows? Who knows what could happen?
Yeah, that's not good. Yeah.
So for those who do connect with your words and have been listening and are maybe interested in seeing you for Reiki or chiropractic or any breathing work or services like that, how can they find you and set up services with you?
So my website is www.guidingpointhealth.com. You can find me on Facebook. It's Kaitlyn Schultz, DC, Reiki Master, or the handle itself is at Guiding Point Health. That is also my handle on TikTok and Instagram as well, which I have all my links on my Insta as well, so they can just click the link. If you don't like the internet and you're not about it, just give me a call, 814-479-0206, or you can message me through Facebook. I try to be available during my hours that I have posted, and if I'm not available, I try to get back to you within at least 48 hours, so especially if it's the weekend.
Yeah.
But yeah, that's how you can find me. I'm hoping to be around for a really long time.
Yeah, I think so. You did a great first year, and there will be many to come, I'm sure.
Let's hope for the best. I love it. Yeah, I love what I do. So thank you so much for having me.
Yeah, thank you for coming on. I really enjoyed this conversation.
Yeah, I did too. Thanks. All right.